Over the last weekend, the Ministry of Health has been actively pursuing its education program for COVID 19. Today, we speak with the Honorable Minister of Health, Dr. Frank Anthony, who gives us a COVID 19 update. Minister, again, good morning. We know this weekend has been busy because you've ramped up the more in the field. So, and you've gotten all your ministerial colleagues basically to also join in this fight against COVID 19. Could you give us an update on that?
Well, we did a outreach to various marketplaces and places where people are gathering. So we were in all of the regions. We were in Region 1, for example. Some of the ministers were there. They met with people, they talked to them, and that's the kind of interaction that we want to see. The Prime Minister was, and Minister Hugh Todd was at Stabroek Market. Other ministers went to Border Market. I myself, I went to Plaisance yesterday, and we had a fairly myself and Minister Teixeira. We were at Plaisance Market, and we had a good interaction with the vendors there. But some disturbing things came out of that walk and interaction that we had, and that is quite a lot of the vendors, they're not wearing masks. Um, and if you don't wear the mask, well, then you know what would happen, because there are lots of people who would come to the stall. You don't know the status of that person, and that person can be positive, don't even know they're maybe asymptomatic, and then they come to your stall. You're not wearing any protection, and what would happen then is that you can be infected. So we observed quite a lot of the vendors weren't wearing any masks. Some of them had masks, but they were using them inappropriately. A lot of people had them under their nose, which, if you have the mask under your nose, it's useless. The simple reason being that transmission occurs when the virus gets into your nostrils and your upper respiratory tract. And therefore, if you're exposing your nose, then you're making yourself vulnerable to the virus. And we tried to talk to some people. While we were there, they put on back the mask, but I don't know how long that is going to be. But it's really for their own sakes, their own good, that they need to use the mask. We also observed that the people who were coming to buy, the customers, quite a few of them did not have on masks. And I observe as well that you had a number of what I would say older persons, persons above 65, who are selling at the market, who are going there as customers. And if many of them do not have on their masks, then they're putting themselves at an extreme risk. These persons are the ones who we have, I mean, the older persons from our mortality profile. We are seeing that older people are dying. We are seeing that persons with comorbidities are dying. We are seeing people who are immunocompromised are dying. And that's why people who fit these categories, they really need to take their precaution. And just walking through the market yesterday, I would have observed a lot of people who fit these risk profile, but really they're not taking precautions. So obviously, I think while I think the exercise that we did is an important one and a good one, where we shared information, we spoke with people, and hopefully that would lift their awareness and they'll do the right things. We have to find other means of sustaining this type of education. So this is the first step in that direction, but we have to sustain it. And we hope that we can recruit persons that we find there, maybe some of the vendors themselves, to act as peer educators with other vendors. We're hopeful that customers, when they look at programs, that they would understand more why they need to do this. Why is it that they need to wear a mask? And then in some of the markets, I don't think they have enough sanitization stations. And again, we need to maybe work with the local government system, these markets, and so forth, to ensure that more of that is in place. But even some of the vendors themselves, they can start walking with the alcohol to have people sanitize their hands and things like that. So every little bit contributes to the fight. And there are many, many things that people can take on and help us with this fight, because this is not a Ministry of Health thing or another ministry. This is what they have to do. All of us got to be involved in this for us to make that difference. And I'm hopeful that while we would have had a successful activity on Friday, Saturday, and Sunday, that we can get more people involved, and hopefully we'll change the attitude at these markets and other places where people have been gathering.
Right. And Minister, you did mention previously that persons can become the educators as you said.
Yes, and we want to work with people. So if people want to volunteer, we'll be willing to work with them. The COVID Secretariat, um, we can work with them, give them some basic education on how COVID is transmitted and what can be done to prevent the transmission and other things. So, we are willing to work with them.
Provide material as well.
And we'll provide material. We have some T-shirts that we are giving out. We have some hats. There are little things that we give so to remind people that COVID is a serious disease that we have to battle with.
All in the education process.
Yes.
Minister, you indicated that you will work with the local government ministry, just confirming that you would have the budget to facilitate any little project.
Yes, and we have been working with them because this outreach that we did was in collaboration with the Ministry of Local Government, Ministry of Social Services, and several other ministries. So when we do these things, it's not just one ministry, it's a whole government approach that we have. All ministries, all different governmental sectors are involved. But we want to move from a whole government approach to a whole society approach where everybody is involved. And that's the thing that we're trying to get going.
One of the major things happening, the ventilators. Last week you told us that they would be here by Monday, and they are in fact here.
Right.
So could you give us an update on that?
So we have a number of ventilators that came in. I think we have 26 that came in, and we will start the distribution this week. As we were repeatedly saying, we want to build the capacity of the region, so some of these ventilators would be deployed to the various regions, and we have trained persons in the region to understand and to know how to operate these ventilators. So I'm hopeful by the end of this week that we will be able to deploy ventilators to all of the regions. We would also be adding capacity to the Georgetown Hospital. So their infectious disease ICU, we will be adding some more ventilators to what already exists there. In addition to that, we have started to put in the medical gas at the Ocean View facility. So over the weekend, we have had a contractor working to install medical gas. This is ongoing work. Once that work is completed, we would have about 27 ICU beds at Ocean View. And that would substantially increase our capacity to manage serious COVID patients. So instead of what we're doing now, if somebody developed maybe a severe form of COVID, we have to move them from Ocean View back to the Georgetown Hospital. Once this ICU is up and running, we will be able to manage all the patients right at Ocean View. So that's something that we are working on. And as I said, we have started with the installation of the medical gas lines and other things to make that area functional. We would also have we have some pieces of machine that would have to be bought and brought into the country. These include some extractors, oxygen tanks, and so forth. So all these things we are working on simultaneously. So we are very optimistic that we'll get this up and running in the shortest possible time.
Minister, as we wrap up, I want to ask you specifically, in terms of the frontline workers, the medical workers at the various institutions, I know that there are initiatives in place to help them cope with COVID-19 as well. I also understand that specific measures are being put in place, I think child care and so on, to assist those workers who work around the clock. Could you tell us a little bit about that?
Well, I don't know that anybody is working round the clock, but um, we have been working with our frontline workers to provide various other reliefs. So, for example, for some of our workers, say at Georgetown Hospital, we do provide transportation for them to get home and things like that. So, there are a number of other benefits that they will get, and we'll continue to do that because we want to ensure that our health staff they are safe, and once they are safe, we'll be able to manage our patients. So this effort continues, and we are going to, you know, keep working to improve conditions for everybody who's working in health.
And is there counseling also for them?
Yes, we do have a program where if anybody feel burnt out or fatigued, that they can contact some of the psychologists that are on staff to give them counseling and guidance. And in fact, next week, through health, the mental health division, we would start a program where we'll be teaching nurses and physicians um, how to deal with mental health problems for patients that they would encounter, how to deal with things like depression, how to do counseling, and so forth. So it's actually a very extensive program. It would probably have maybe about 8 or 9 sessions and in specific areas. So next week, I think Monday, we'll be launching that program so that more of the healthcare workers would understand the importance of mental health and how to detect some of these problems and how to resolve them when they see them. They'll be able to provide that type of assistance.
All right, Minister, any last words to the public before we go?
Well, the last words are basically the same, and that is we really want people to use their masks properly because this really is one of the key ways in which we can prevent transmission. And if we don't use our mask properly, uh, we become vulnerable to the infection. So I want people to understand that it's not a joke, it's a serious thing, and people therefore should abide by these rules. So mask wearing is important. Keeping your distance is also important. So when we are in the public, as we have been advising, stay 6 feet apart. Um, sanitize your hands. These are three basic measures that one should take. The other thing is that when you're in indoor environments, that doesn't mean that you have to take off your mask. I see a lot of people when they come indoor, the workplace settings, they're more relaxed because they're seeing familiar faces and so forth, that they want to relax the rules as well. And they don't observe social distancing in the workplace. They sometimes take off their masks and they interact with people. Well, there's a opportunity there as well. If you breach those rules, then you'll get infected. So I just want to appeal to everyone, follow the rules, and if you see somebody around you that is breaching the rules, talk to them, help us to educate them, If each one of us teach the persons around us, then that message multiplies and everyone would be better educated and aware of how this disease is spread. And I think we'll be able to curtail it once we all work together. So I hope that we can recruit more and more people in this endeavor to prevent the spread of COVID 19. Thank you.
From the Ministry of Health with videographer Joanne Jordan, I'm Felicia Valenzuela. Thanks for joining us.